Welcome back to the show, everybody. As we start this new year, the biggest resolution is getting into shape by doing a home workout program or hitting the gym. Unfortunately, a lot of folks just give up on either of those routines, and many will just set themselves up for failure and injury. What most people neglect more than building your core is balance. Welcome to the show. Once again, Dr. Nick Circolone and physician's assistant Julie Carr from Apple Physical Medicine Center with some short exercises to help improve balance and stability, which will reduce injuries and increase performance. Julie, it's so good to have you here.
Thank you.
I'll start with you first. We're talking about physician's assistant. This is really unusual that you have a chiropractic office. You just graduated from being a physician's assistant. Never imagined that you would be working in a chiropractor's office. But you know what? This is the way people are going these days.
It is. I'm a nurse practitioner.
Oh, what did I say? Physician assistant.
Yeah, that's okay.
I'm sorry, nurse practitioner.
No worries.
I'm so sorry.
No worries. Yes, no, there was no way I was thinking I was going to be in a chiropractor's office, but it really works there. It really adds a different, light to the chiropractic office there, and we're able to do more things and see more people and address more things there.
It's become a one-stop shop that people want to get well when it comes to aches and pains, but you know what? Their history can be taken when it comes to medical history, and you can follow that patient through their routine.
Well, what's beautiful about that is, and we're talking about balance and stability. Well, balance could be caused from a lot of things. Inner ear infections, sinus infections, could be a problem with the otoliths in the ear. We want to look at that first before we start doing balance training with someone. Because if their balance is off, we're worried about that they might get hurt.
Especially with seniors.
Oh, absolutely.
We're both going through that with our dads.
Yes.
We understand the importance of balance, stability with the older you get.
Well, Dad broke his hip 4 years ago, actually one, and then he broke it several weeks later, a second hip. But what happened was his balance was so off, he just lost his balance, fell, and broke his hip.
So what we're going to show people right now, these exercises, is this something that you can do with an older patient in your house?
Absolutely. What you want to do is when you do any kind of balancing, you want stability first. So what I suggest is that, before you do anything, find out if you're able to exercise and do these things from your doctor. The other thing is have something that stabilizes you, a chair in front of you. So basically what you're going to do is you're going to stand there and hold the chair and kind of lift one leg. And a lot of people have a hard time holding that leg up. Now, and just holding that chair gives you some of that stability. And then you could find yourself leaning against one and then taking both hands away. Those things right there is a great exercise to do. Now, I want to show you something. Stand up for a minute. What I want you to do is just one leg.
Yeah.
Hard to do.
Yeah.
Okay.
But why?
Because your balance is still off. Now, what you want to do is now close your eyes and do it.
I know.
You can't do it. It's hard to do without.
Yeah.
Tell me. So one of the things you could do to practice this is start with one leg and just hold it there. And when you get comfortable with that, then you can stick your leg out a little bit further, then a little bit further.
Well, forget it.
And then you could come down and start doing a squat with one of those. The other thing is you can add weights to it to help with some of the balance.
There we go.
If you lift your left leg, you want to hold this in your right hand, so you get your balance and kind of switch between them. These things you want to be able to, this is going to help retrain part of your brain to do that. The other thing that you could do.
Would this be good for stroke victims?
It could help. It depends on where the stroke is. So what you want to do is you want to make sure that they're able to do some of this. And they do that in the hospital and rehab centers. They work on their balance. And that's what's really important is once they get their balance, they could do some of these other exercises. And once you progress and feel that you're comfortable with your balance, what you want to do is you want to add some things into it like core, Pilates, things that are going to strengthen, yoga and Pilates, and strengthen up that core and help that balance as well.
We're talking about integrative medicine, and this, Julie, is something that everybody is into these days. Everybody is looking for new ways to get well, to stay healthy. They're looking for different options besides the regular type of doctor's office. I think that's what you're finding.
I think that balance and even the core strengthening, they all go together and will really enhance life for people, especially with the elderly, preventing falls, and even in the younger population, it will really enhance your performance in the activities that you do.
When you go to a nurse practitioner like Julie, then will she make some recommendations to you about the next step? Well, once they can get blood work done, you can actually go to Julie as your doctor?
Yes. And see her. What's beautiful about Julie being in the office is once Julie sees a patient, we talk about that together. Once we talk about it together, we come up with a plan. This is what we're going to do. This is how we're going to work it. And this is what they're going to need.
So in other words, she can say, I think balance is a tremendous issue for this
Absolutely.
patient. Let me ask you, first of all, I want you to tell me about the new certification that you just got. Congratulations, you've worked years to get this certification, which is what?
I'm actually a chiropractic orthopedist. With that, easy way to put that is I'm kind of a liaison between the chiropractic community and medical community. We talk the same language as medical, as chiropractic. So we get these patients to where they need to be. Some things we can deal with. Most chiropractors can deal with a lot of things, but we deal with arm pain, hand pain, neck pain, shoulder pain, leg pain, joint pain, other than just low back and neck. So we kind of address these. If we have to brace them, we'll brace them. If they need special services, we make sure we make the proper referrals to those services.
So one of the most important things we're seeing in 2014, greater respect among the medical community and the chiropractic community?
We're hoping that's going to happen. We're hoping that's going to happen.
Nick, it's great to see you.
Always a
Julie,
good
always,
see.
I'm so sorry I called you a physician's assistant.
No worries.
You are a first-class nurse practitioner. Here's the information. How does that look?
Oh, it's great.
It does, doesn't it? That's Emma. Apple Physical Medicine and Rehabilitation, 7446 Shallowford Road, 855-7376. They are located right next door to the YMCA on Shallowford Road. AppleRehabGroup.com. Nick, all the best to you. Happy New Year. Stay healthy. We're back after this.
Thank you.